Hi, I wanted to speak today a few minutes about how to sit properly and some of the ways I've been teaching my patients to sit. If you have to sit, I generally think about not sitting, all the way back, rounded forward. This rounding puts all the pressure on your lower back. So a simple way to do if you're sitting in a regular chair that can't be turned or moved is to just sit at the edge of the chair. The arch in your spine is what takes pressure off your lower back. So when we're sitting back on a chair, that rounding or kyphosis or straightening of the lower back is what puts all that tension on our lower back. So rounding forward's sort of no good. And it's really about this angle right here. This being 90 degrees is what makes that arch go straight. So if you have to sit on a chair, best way is to sit as upright as you can, trying to sort of open up this angle, and then you can't really slouch if you're sitting towards the front of the chair. I've been asked about knee chairs. The knee chair is a little bit better because it allows you to open up this angle. So it's not exactly like standing where it's 180 degrees. You're somewhat still, but it's better than regular sitting. Sometimes this can put a lot of pressure on your tailbone, so you have to sort of play with these cushions. I've had people just sit on these too long, and there's a lot of, it's sort of the pressure on your bottom is a little bit different. So you sort of have to, maybe trial and error, try sitting in one. Some people don't like it, some people like it, but this is a little better because you're opening up this angle here. And then more weights on the knees instead of it all ending in the lower back. The best way that I know how to sit is sort of a chair with a low back on it. And what you do is you sort of put your stomach onto the lower back part of the chair, and you're trying to actually arch this lower back. That doesn't look very professional. You have your bottom sticking out, but that's how your back should be. Allows you to give the most arch, and you're actually trying to, if I had to exaggerate, you're almost trying to lay down. So commonly when I'm doing paperwork, I'm in this type of position. You want to have the keyboard or mouse kind of here. You don't want to be holding your arms up. You want this at a 90-degree angle here. Head is upright, back arch. The legs can be in a couple different positions. You can have the legs sort of in the front. I sort of believe the best is to keep them sort of towards the back. And you can, this puts, it takes a lot of the burden off the disc. A lot of times though, if your back is too stiff, Ed, I can't get comfortable in this position. I can't get there. And so getting adjusted, getting your spine loosened up enough that you can even do this. I have patients with, if your lower back is aggravated, this might make the lower back a little bit more upset. So this is sort of a maintenance position. If you're not in pain, this is the best way to prevent yourself from getting into pain and preventatively. But it can be difficult if you're dealing with back issues to get into this position. So get care and then start maybe more slowly, starting more like this, more upright, and then trying to induce as much sway in your lower back as you can. Just takes a lot of the burden. Whenever I have to do, going through college and school or paperwork for long periods of time, and then you can vary it up. It's sitting is sort of sitting in one position too long is what causes problems. So if you spend all your day like this, or bent forward, this is sort of worse. The worst type of sitting I'll see people do is they'll, sort of sit with the leg up, kind of like this. And this, while it might feel really good because you're taking the weight off the joints, this puts an immense amount of pressure on the disc. If you're doing both knees, it would be really bad. But usually it's like kind of one knee. People sit there, on their computer with one leg up. This just puts a lot of pressure on the disc, which doesn't have any feeling, but then causes bigger problems in the long term with disc injuries. Obviously, the worst way to sit, is spending a long period of time, rounded forward, reclining. This, if you have joints that are inflamed, this might aggravate them. Or some people get relief, especially if you're older. This might give relief, kind of like a lazy boy chair. This position, rounded forward. After you spend, hours in this position, after you come up, you have trouble getting back to upright because you've spent so much time rounded forward. So the best way to sit, if you can, keep this, you're trying to get the weight of your stomach onto the pad there, arching up, keeping your head upright, keeping your head over your shoulders. That's the best way to sit. Hi, I wanted to speak today a few minutes about how